All right, let's talk about everyone's favorite subject, trachs. Now, if you're not very familiar with a trach, it can be really intimidating, especially just starting out and you're supposed to do trach care on the patient. What exactly do you need to do? So let's talk about how do we do trach care. But first, let's actually talk about what the trach is and what it looks like. So this is your tracheostomy tube. You can notice that there is a balloon on the end for it to either be cuffed or uncuffed. And this plastic tube fits inside the tracheostomy. At the front here, we have our inner cannula. The inner cannula can either be reusable or disposable. This one is disposable, and among other things, we know it because it says do not clean or reuse. Now, our patient over here also has a non-reusable one. So let's take it out. We're gonna pinch these wings, and we're gonna pull it out. What you see is that we have this little plastic tube. This fits right into the trach. And with these, we're just gonna throw it away and grab a new one. Once you have your new one, you just stick it right back in. Make sure that you pinch those wings again to put it back in place. So that's a helpful piece of information that as you remove this inner cannula, you're not actually removing the trach. Remember, there's already this plastic piece here. You're just removing this little inner piece that can be cleaned out. You're obviously concerned about mucus plugging the end of this and actually cutting off their airway. So we've changed the inner cannula, and now we actually want to clean this area. If you've never taken care of a trach, just know these things get gross, and they get gross pretty fast. You don't realize how much mucus you have in your throat, but there's a lot of mucus that comes around here. So you would open up a trach cleaning kit, a trach care kit, and it may come with these little Q-tips. You'd want to put them in some saline or peroxide, and you just want to clean around. You want to use one to clean around, underneath, all over, get it real nice and clean. And once you've cleaned that, you want to change out your trach ties. Now this is really important. When you're changing trach ties, you only change one side at a time. So I'm never going to release these trach ties on both sides. I'm only going to do one. If you need a friend, get a friend. So I'm going to remove one side here. Now that I've done this side, let's move to the other side. You may notice that it's a little long. Well, I can actually readjust the length with a little tie here. You don't want this to be too loose, and you don't want it to be too tight. So just make sure you can get your fingers under there, but that this thing's not gonna come out. So once you're done with that, you can put their trach collar back in place, and you can make sure that they've got plenty of oxygen. So that's trach care in a nutshell. Like and follow for more.